Good evening, everyone. This is Dr. Shrija, and today we will learn about the topic Dentin. So, as we can see here, the tooth structure. So, the first layer is the enamel. This is the second part, which surrounds the pulp. So, this is the dentin. So, today we will discuss about dentin. These are the pulp chambers. These are the gingiva, gums. These are the cementum, periodontium, in which the tooths are embedded, bony structures, nerves of blood vessels are innervated. These are the crown area. This is neck, and this consists of your root area. So, so as we go to the next slide, so here we will study about introduction, physical properties, chemical properties, structure, what are dentinal tubes, orthoplastics. So dentin. Dentin is the hard tissue of the tooth that surrounds the pulp and makes up the bulk and general form of tooth. So as we saw the diagram, where we saw just that dentine is the layer that surrounds the pulp chamber, and also it makes up the bulk and general form of the tooth. How dentine is characterized? It is characterized by the presence of tubules throughout its thickness. Dentinal tubules contains process of odontoblasts within them. So dentin is either a living or a vital tissue. Next, what are the physical properties of the dentin? Color, it's light yellow in young age, and as it becomes darker with the advancing age. What are the consistency? Elastic and resilient. It is harder than bone, but softer than enamel. Now, what are the chemical properties? Composition consists of organic matter 35%, inorganic matter 65%. Organic matrix, collagen fibrils, ground substance, mucopolysaccharides, proteoglycans, glycoaminoglycans. So these are your organic matters. What are the inorganic components? Calcium phosphate in the form of hydroxyapatite crystals. These are very important. And what is the formula? 3CO3 PO4 whole 2 dot CaOH whole 2. And it is of plate shaped. It is smaller than the hydroxyapatite crystals. And it also contains small amounts of phosphates, carbonates, and sulfates. What is the structure of dentine? Structure, as we saw that it contains odontoblasts. So odontoblasts are present in the pulp and are arranged in a layer lining the pulpal surface of the dentine. Dentine was present in between the enamel and pulp. So odontoblasts, where are odontoblasts present? They are arranged in a layer lining the pulpal surface of dentine. Now each cell gives out a long, thin process which enters a hollow tube-like structure within the dentin called as dentinal tubules. What are dentinal tubules? They are transverse throughout the thickness of the dentin. Here in the diagram, you can appreciate that the dentinal tubules are transverse throughout. Now it follows a S-shaped curvature. Okay. Starting from the pulpal surface, the first convexity of the curvature is towards root. Curvature is less prominent in the root portion. Here you can see the diagram, enamel, dentinal tubules, and in between the dentino-enamel junction. Now, how tubules are present? Tubules are perpendicular to the dentino-enamel junction, as you can see here. Dentino-enamel junction, and to which dentinal tubules are perpendicular. Near the root tips and incisal edges, the tubules are almost straight. Surface area of dentine is greater than enamel surface than at the pulpal surface. Dentinal tubules are further apart at enamel surface of dentine. Tubules are larger in diameter at the pulpal end as compared to the enamel end. So here at the dentino-enamel junction, The enamel where the layer is ending, that is the starting portion of the dentine junction. Okay. So, number of tubules per unit area at the pulpal surface is about 4 times that of the enamel surface. More tubules per unit area in the crown portion and to the root. So these are some tubules detailing that to lateral branches of dentinal called the microtubules. Few dentinal tubules extend throughout the dentinal, which are also known as enamel spindles. Okay. So what is peritubular dentine? As the word itself says, peritubular. Peri is around the periphery of the tubules. Dentine that immediately surround dentinal tubules are as peritubular dentine. Here you can see there are tubules, and surrounding the tubules there are peritubular dentine. Intertubular dentine is the one in between the tubules. Okay. So it is found throughout the thickness of dentine except near pulp, more highly mineralized than intertubular dentine, twice as thick in outer dentine than in inner dentine. Thin organic membrane rich in glycose, aminoglycans, and the inner side are limited. Okay, so what is intertubular dentine? It is located between the dentinal tubules and forms the main body of dentine. So, intertubular as tubule forms the main body. Here you can appreciate that it is present of the dentin structure. Of course, it is less mineralized. It has collagen fibers around the tubules. Fibers are 0.2 to 0.5 micrometer in diameter, and it exhibits 64 micrometer cross binding. So these are the some which you can appreciate in your MD's exams. Hydroxyapatite crystals are present with long axis parallel to collagen fibers. Now, what is pre-dentine? So the word itself denotes pre-dentine, before dentine. So 2 micrometer to 6 micrometer wide layer of unmineralized dentine matrix located adjacent to the pulp tissue. It is the first form dentine. So this you have to remember. It is the first form dentine. Thickness depends on the activity of the odontoblasts. So here you can see odontoblasts present in the pulpal lining, and here it is dentine, and in between there is the formation of pre-dentine. Now, what are odontoblastic process? Cytoplasmic extensions of the odontoblast into the dentinal tubule. It is greatest near the pulp and tapers further in the dentine. Now, what is the extent of odontoblastic process? So for this, we have two theories. Odontoblastic process extends throughout the thickness of dentine, and the second is odontoblastic process is present only up to partial extent in dentine. So these two theories are still debatable, but we can appreciate both of them. So odontoblastic process is composed of microtubules, mitochondria, lysosomes, and microvesicles. What are the types of dentine? There are three types of dentine: primary, secondary, and tertiary. What is primary dentine? It is the dentine that is formed before root completion. Here in the image, you can appreciate all the dentines. Okay, the enamel structure, and in the after enamel, there is a dentine in which you can see circumpulpal, secondary, mantle, and reparative dentine. So what are the major part of dentine? Mantle dentine, that is the outer layer. You can see the outer lining, that is the mantle dentine. Circumpulpal dentine, circumpulpal, circumferentially around enclosing the pulpal area. Okay, so mental dentine. It is the first form dentine in the crown, remember. Seen just below the DEJ dentino-enamel junction, thickness is 20 micrometer. Organic matrix is formed by the collagen fibrils arranged perpendicular to the DEJ, linear mechanism of calcification. So what is circumpulpal dentine? The remaining portion of the primary dentine which forms the bulk of the tooth. Collagen fibrils are much smaller here and they are closed packed together. may be slightly more mineralized than mental dentin globular mechanism of calcification. So in circumpulpal, we follow the globular mechanism of calcification. Now, what is secondary dentin? It develops after root formation. Okay, before root formation was the primary, after formation is the secondary. So here the slower rate of deposition is there, tubules are less regular, and greater deposition on the roof and floor, which your results in pulp recession. Okay, so tertiary dentin. It consists of it. Tertiary dentin always presents the stimuli type of dentin. It is produced in reaction to various stimuli. Stimuli like what? Atresion, caries, or a restorative dental procedure. It may activate tubules. What are the cells entrapped in tertiary dentin? They are the osteodentine cells. Okay. Reactionary dentin, it is the pre-existing odontoblasts, and reparative dentin, newly differentiated odontoblasts like cell. Okay. So incremental lines, these are very important. Incremental lines, they are the represent daily rhythmic deposition of dentin. They are the daily rhythmic depositions of the dentin, and they run at right angles to the dentinal tubules. To the DJ, dentinal tubules fall at right angles, and to dentinal tubules to the right angles are the incremental lines. They are set by 4 micrometer. It represents daily deposition of dentin. Okay. Now, what are incremental lines of von Ebner? Attenuated incremental lines separated by 20 micrometer, and it represents 5-day deposition. Daily deposition, incremental lines, 5-day deposition, incremental lines of von Ebner. Lines caused by attenuated deficiency in mineralizations, it is termed as contour lines of Woven. Okay, so here you can appreciate. Okay, what is interglobular dentin? The unmineralized or hypomineralized dentin where globular zones of mineralization have failed to fuse into a homogeneous mass within mature dentin. So they are the interglobular dentin, the failed mass, the failed fusing masses. Why? Because of vitamin D efficiency, high level fluoride exposure, okay, where it is seen most frequently in the circumpulpal dentin just below the mantle dentin. Here once in the image I saw you what is circumpulpal the mantle dentin. Normal dentinal tubular architecture is visible, defect of mineralization and not of matrix formation. No peritubular dentin exists around the tubules. Okay. Yeah, here you can see primary dentin, interglobular dentin, dentinal tubules, which are perpendicular to DJ, interglobular dentin in between the tubules, which forms the main body, dentinal tubules. Okay, so what are the granular layer of tones? When drying brown sections of root dentin visualized in the transmitted light. So where do we have to visualize it in the transmitted light? What do we see? A zone adjacent to the cementum appears granular. As the name suggests, granular layer of tomes, so the appearance is also granular. More prominent towards the apical portion, it is caused by coalescing and looping of the terminal portions of the dentinal tubules. Dentinal tubules, the S-shaped, as you remember, it is caused by the coalescing and looping of the terminal portions of dentinal tubules. See. Dentin, at the apical portion of dentin, you can see a layer which is appreciated as the granular layers. So it is known as granular layer of tones. Okay. So eight changes in dentin. Sclerotic dentin, dentinal tubules that have become occluded with the calcified material. It is assumed a glassy appearance and becomes translucent. So it is also known as transparent dentin. It is more common in the apical third of the root. It is a physiologic response to aging. It is thought to be due to continued deposition of the peritubular dentin, deposition of mineral within the dentinal tubules, or mineralization of the odontoblastic process. Okay, so what is the reparative dentin? As we have studied tertiary dentin, remember it was due to the reflex of the stimuli like your restoration or any further treatment. So this is a form of tertiary dentin. Okay, as I said you that it was noxious stimulus tertiary. So reparative also the same noxious stimulus on the pulp. Differentiation of odontoblast from the unreparated cells in the pulp. Odontoblasts lay down a layer of dentin in the exposed area to protect the pulp from damage. Fewer and more twisted tubules than normal dentin. Dentin-forming cells are usually trapped within dentin. This we have studied before also. See, in the diagram, the dentin, carious dentin, you can see tertiary dentin, which will again respond in the stimuli if there is caries or atresia or anything. Tertiary dentin you can see, pre-dentin you can see. Yeah, this I've seen before. Now, what are dead tracts? Due to death and loss of odontoblastic process, dentinal tubules become empty. So, as it becomes empty, it becomes filled with air, and as it is filled with air, it appears black in the transmitted light. So, air does not allow the light to pass. So, these are your dead tracts. Here you can see the it become empty, so it is filled with air, and in which the light cannot pass, so it appeared black. Okay, so where we can see, as I said, you any response to stimuli area like caries, atresion, abrasion, erosion, any cavity preparation. Okay. So, clinical consideration, restorative procedure. While you're doing the restoration, while you're doing the cavity preparation, minor routine procedure crisis from the perspective of the pulp, fluid shift, simple restorative procedure, profound effects on the pulp. So dentin is a very, important in the restorative procedure. It plays a very important role in the restorative procedure. And they will read here also. Sensitivity of the dentin on root areas. When people say usually we are feeling sensitivity, so it is only due to the dentin, okay? Because it is only the layer which surrounds the pulp, as we have studied. On root areas exposed due to the receded gums or periodontal disease, root of a tooth becomes exposed. It does not have a layer of enamel but cementum. So these are important clinical consideration that you should understood. Overzealous brushing. Brushing techniques are also very important. I hope so. You all know the brushing techniques. Or using a very abrasive toothpaste can also cause abrasion of the tooth's enamel surface and expose your dentin. Very acidic diet, like we all prefer, eating Coke and all. So if we are having very acidic diet, it can also cause tooth erosion and dissolve your tooth surface, and again, the exposed to dentin. Okay. Permeability of dentin. Tubular structure of dentin provides passage of solutes and solvents across dentin. It is lowest at DJ and highest at the pulp diameter, and also increases with depth. And this permeability is divided into two categories: transdentinal movement and intradentinal movement. Okay, so what is smear layer and smear plugs? These are also two terms which will be helpful in your restoration part. Smear layer. So the term most often used to describe the grinding debris left on dentin by cavity preparation. Now, cutting debris when forced into the dentinal tubules, it forms plug, which is known as your smear plugs. So now, while cavity preparation, you should be very careful. Smear layer is generally 1 to 3 micrometers. Smear plug is 40 micrometer. And what are the significance of these? Significance is that it lowers the permeability of the dentin surface. Now, what is RDT? Again, very important in the restorative procedure. The It is the major factor in the odontoblast response and in dentin. formation, major factor. As I said, you're very important. The odontoblast injury increases as the cavity RDT decreases, so the remaining dentine thickness, 2 to 3 micrometers, should be maintained. Below 0.25 mm, the number of odontoblasts decreases by 23% and minimal reactionary dentine repair is observed. So you have to follow the RDT steps, affected and infected dentin. So what is infected dentin? As the term itself suggests, infected. So it contains microorganisms. But affected is just contains toxins produced by it, not itself the microorganisms. So what is infected dentin? It is that part of the dentin which is contaminated and contains the microorganisms with their toxins and demineralized dentin. And what is affected dentin? It is not occupied by the microorganisms, but it only contains the toxins produced by them. And also there is demineralization. Demineralization is common, but presence of the microorganisms and the toxins produced by them. So my question is, what should be removed, infected or affected dentin from the tooth structure while cavity preparation? Of course, the infected dentin. So these are the references. Conclusion. Developmentally, pulpal cells produce dentin, nerves, and blood vessels. Okay? All dentin and pulp have different one layer to stimulate a functional unit. Through region case produces profound pulpal reactions that tend to reduce permeability and stimulate formation of additional dentin. So thank you everyone for your attention. I hope so this lecture will be important to you in the university as well as the MTS preparation. Thank you.